is Dr. Delicia Haynes. I'm an integrative family medicine physician, board certified in family medicine and in obesity medicine. When I was in the 7th grade, I was taking a shower one day and I felt a lump in my breast. And at first I was kind of okay with it because I wasn't the most voluptuous person, and so I was hoping if I got one on the other side that I would kind of like be evened out. And that lasted for about 2 seconds, and then I got really scared. But I didn't want to tell anybody or show anyone because I knew I would literally have to bare my chest in order for them to do something about it. So I stayed in denial. I just hoped it would go away, and it didn't. And two months passed, and it was still there, and I was so scared that I went ahead and I told my mom. So my mom took me to the doctor's office. And I remember we waited for about an hour or 2 hours in the waiting room, and then we got brought back into the examination room. And it was this cold blue room, had blue peeling paint, and we sat there, and although the environment itself was really uninviting, I was excited because at that point, or up to that point, I knew that I either wanted to be a doctor, a teacher, or a lawyer. And I found out that if I became a doctor, I could do all three. I could teach my patients and empower my patients. I could also teach medical students. I could advocate for my patients, which is the part of law that I liked. And I could heal people, which is what really attracted me to medicine. And we didn't have any physicians in my family. If we did have a family business, it would be the mortuary services, which I try really hard not to support the family business. But we didn't have any physicians in my family, so I was looking at this as an opportunity for me to meet someone who could be a future colleague of mine and maybe a mentor of mine. So I was really excited. So another hour passes, and finally in walks the doctor, and me and all my 7th grade enthusiasm says, I want to be a doctor too. And he looks at me over his glasses and says, take your top off. And I looked at my mom, and she looked at me and she nodded that it was okay. And so I took my shirt off, and he just walked over and just started pressing on my chest. And then he stepped back and he wrote in his chart, he said, it's probably benign fibroadenoma. We won't know for sure until we have it surgically removed. Due to the location, the surgery scar will be small, so if you want to be a stripper when you grow up, that'll be fine. And he walked out the door. Now, my mom is a Baptist deaconess, so needless to say, that did not go over well with her. And I was devastated. I didn't know what benign meant. I didn't know what a fibroadenoma was. But I knew what surgery was because I had been watching the Surgery Channel because I was interested in medicine. And I started to cry, and I looked over at my mom and I said, Mom, they're going to cut me. And she said, Delicia, put your shirt on, I'm going to go talk to the doctor. So she went out and tried to find the doctor, but he was already in another room and wouldn't talk to us. And so at that moment, I decided that when I became a doctor, I was going to be the type of doctor that I wish I had. The kind of doctor that doesn't make you wait for hours in the waiting room for a 5-minute appointment. The kind of doctor that doesn't do 5-minute appointments. The kind of doctor that explains everything to you in layman's terms, in plain English or plain Spanish, in ways that you can understand. The kind of doctor that, if you didn't get all your questions answered at the time or you forgot what they said, you can call back later and you can get that done. You can understand. I think that the well-informed patient is a therapeutic ally. So it's really important that my patients understand what's going on with them so they can be empowered to take control of their health. And then I'm kind of like, co-creating with them their treatment plan. And that takes time. And our current system is more like an assembly line production. It's how fast can you go, how fast can you see people and get them in and get them out. And so the part that you don't have a lot of is that time it takes to consult with people, which is really where the healing starts. In medicine, one of the most important things is to get an accurate diagnosis. And we know that 85% of a diagnosis comes from what's called taking a good history. And all the history is you as the patient are sitting there and you're talking to the doctor and you're telling them what's going on with you, and the doctor is listening to you and asking you questions to get an idea of what it is and what it's not. So that's really the most important time, and I think that the doctor-patient relationship is sacred. And that's the part that in our current system isn't being valued. So we value cutting people, we value procedures, but we don't value the time it takes to consult someone where you can help them change their life What also happened, around September of 2014, I got a contract in the mail. And it was from the area's largest insurance company. Now, my personal insurance was with them, and my premium had gone up 10%. And then I got the contract as a physician with a 40% cut. And I realized at that moment that I had built my business on quicksand. That when another entity, a third party, could make a decision that effectively could put me out of business, I wasn't working for myself, I wasn't working for my patients, I was working for them. So I called around to my mentors again, and I said, what are you guys doing? And they basically said, you either sell or you sign it. They own this community. So I had a decision to make. I could sign this contract with the 40% cut, and I could double how many patients I saw per day and spend like 7 minutes with everyone, which is the kind of doctor that I never wanted to be in the first place. I could fire all my staff to try and make it work financially. I could sell to another organization and kind of lose control of the healing environment and still be probably in that assembly line mode of medicine where you're seeing a patient every 7 minutes and you're timed for everything. Or I could leave medicine altogether. I could go back to being a decorating consultant, which is what I did before medicine. Or I could do something radically different. I could actually take a stand for the doctor-patient relationship, and that's exactly what I decided to do. So in 2015, we transitioned and became the first direct primary care office in Volusia County.